out at the end of a long day. It's interesting to be talking in the hammer and tickle session. I think what I'm going to be talking about is more bubble and squeak, and my colleague Jonathan Stoy will translate that for all the non-English speakers in the audience. So the project I'm going to be describing is the effects of estrogens and estrogen receptor on HIV transcription. And this system has rather profound effects on the control of transcription and seems to be associated with gender differences in transcriptional control and the reservoirs in differences between men and women. Now, we first got involved in this area a number of years ago when we performed an shRNA screen in T-cell lines similar to the lines that Camel used and just described. And you can see in this slide sort of the major principles that came out of it. So first, on the top two panels, you can see that there's a very low basal level of expression in these cells, and when the estrogen receptor is knocked out, it reactivates the system, and you get a lot of high levels of expression. Now, you can do the same kind of manipulation with pharmacological interventions, and you can see that in the bottom left-hand panels, the effect of antagonists. If you antagonize the receptor with fulvestrant, which is a direct effect, and gossypol, which is hitting one of the cofactors, you can get mild reactivation. Now, on the other hand, the agonists, in other words, the hormone mimics, are acting in the opposite way. So this is very gratifying that you have a pharmacology that can be run in both directions. And so to look for the effect of the agonists, you need to reactivate the cells in the first place, and this is done in this case with TNF-alpha, which is inducing NF-kappa B, and is a very potent stimulus. And you can see that this particular agonist that we chose profoundly inhibits the TNF reactivation of the system. And that's a very striking and unusual kind of effect. Now, we can, in these systems, look directly at the gene with chromatin immunoprecipitation assays. And here's a result of that system where we're looking in blue at the estrogen receptor, at the HIV proviral LTR, and at red at the RNA polymerase. So this is a latent system, and as you would expect in the latent cell, there's minimal RNA polymerase at the promoter and a significant level of the estrogen receptor. After treatment with TNF-alpha, and this is in 2 different doses, you can see the system gets activated, RNA polymerase levels go up profoundly, and there's a displacement of the estrogen receptor from the promoter. And similarly, when you treat the cells with estrogen receptor antagonists, in this case, fulvestrant, which we refer to as ICI in many of the slides, you can see that RNA polymerase levels go up, and as expected, the receptor levels go down, and you have an augmented effect with a suboptimal dose, a minimal dose of TNF-alpha. And again, because the pharmacology works in both directions, you can do this in the opposite direction with an agonist, in this case a compound called PPT, and there's a large increase in the level of estrogen receptor at the promoter. So the receptor is something that's is recruited, it's stabilized by hormone, and leads to repression, and when you reactivate HIV, the receptor has to be displaced. Now, we've also looked at these effects in a primary cell model. Many of these models are familiar to many of you. What we do in this case is we start with naive cells, polarize them and expand them, infect them with a reporter virus that has a GFP fused to a surface protein so we can purify the infected cells, and we force the cells into quiescence. As the cells go into quiescence, transcription is inhibited, and you can see that the quiescent cells are truly quiescent. They're not expressing cyclin, and they're not expressing Ki67. Upon reactivation, there's profound activation of HIV transcription in the system, and you get NEF expression, which is the way we measure virus reactivation, stimulated in about greater than 80% of the cells in the population. Now, using this kind of system, we can look for synergy effects and inhibitory effects of compounds in the system. So the black bars show simply the control system. In the unstimulated cells, there's minimal HIV expression because they're latent, and the estrogen antagonists are able to reactivate the virus, and the hormones, either estradiol in this case or stilbestrol, which is a synthetic mimic, do not activate. In fact, they mildly inhibit. Now, in the face of a very strong stimulation like T-cell receptor, there isn't any measurable additional effect of the antagonists because the system is completely turned on, but you can see profound inhibition by the hormone and stilbestrol, and so on with other activators. You can see additive effects of the antagonists with suboptimal activators and profound inhibition with the hormone and the synthetic analog. So with this as a background, I got involved in a clinical study that Rowena Johnson was putting together for AMFAR, and I guess she felt that it was important to have somebody who was totally unqualified to do clinical work and as part of the team. And the purposes of this study was to see whether there are any differences in HIV reservoir size between men and women, and the enrollment in this study was focused on women of reproductive age who aren't taking any exogenous hormone therapy. Now, this is quite a large study. About 150 matched men and women are involved in this. Eileen Scully is leading a rather intensive investigation of the reservoir size. My piece was to take 10 matched men and women from the group and evaluate how those cells responded ex vivo to various stimuli. So here's an example of how we're measuring these things. We're using an assay we call EDITS, which is a sequence-based measurement of spliced envelope RNA induction in the system. So these are patient cells. They're treated with various stimuli, and the RNA is measured after 16 hours. So it's a rapid induction of the RNA that we're looking at. Again, it's color-coded. In black, you see cells that are just in culture with minimal IL-2, unstimulated, practically no envelope message is present in the system. If you treat with the estrogen receptor antagonists, you get some upregulation. Estradiol doesn't do anything. IL-15, which is a mild activator in this system, does a little bit. The HDAC inhibitor, vorinostat, gives a mild or intermediate activation. It's very synergistic with the estrogen antagonists, and estradiol is a strong inhibitor of activation under these conditions. And similarly with the T-cell receptor, it's very similar to what we saw in the model system. There's maximal activation with the T-cell receptor, not much augmentation with the estrogen receptor antagonists, but inhibition, significant inhibition by the hormone itself. Now, when we're getting the first data now from the more comprehensive set. So here's the data set from 6 male donors and 5 female donors and 6 male donors, 11 data points done with the EDITS assay. You can see the unstimulated have minimal envelope RNA. Maximal activation is through the T-cell receptor. Addition of estradiol inhibits. SAHA gives an intermediate activation. The estrogen receptor antagonist is not activating on its own, and the combination of SAHA and the antagonist is giving an augmented response. Where things get interesting is when we separate this by sex. The men, as you can see, tend to have the weakest responses to the inhibitory effects of estradiol and the weakest effects in terms of the augmentation effect of the estrogen receptor antagonist. Here's the females, males, females, males. There are no p-values here, but I think you can see the difference. So in conclusion, we're excited about the possibility of using estrogen antagonists as part of a regimen for inducing proviral reactivation. They're well-established drugs. They have quite good safety profiles. It's very significant when thinking about gender differences that estradiol at moderate levels is such a potent inhibitor of viral reactivation and transcription. We're working with 250 picograms per ml, which is sort of mid-level for the menstrual cycle. And I think, as a word of warning, there clearly are gender differences because of hormonal differences, and that needs to be considered when designing these kinds of studies. So thank you very much. Oh, and most importantly, let me thank 2 colleagues who did the work, Biswajit Das, who discovered the estrogen receptor system, and Curtis, who was doing the patient cell assays. So thank you.